Welcome to Doctors on Call. I'm Jenna Miller. Chronic care refers to medical care that addresses a pre-existing condition or long-term illness. If you live with pain, you're not alone. Pain attacks the human body, muscles, bones, and joints. Each person and their pain are unique. More than 20% of U.S. adults have chronic pain, and pain sufferer statistics show that women are more likely to experience pain more than men. The best way to manage your case could be very different from what works for someone else. Chronic care, that's our topic today on Doctors on Call with our guest, Dr. Tyrel Summers.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Hutchinson Regional Healthcare System. Our family caring for yours.
At Osborne County Memorial Hospital, our services range from clinic visits to inpatient and skilled care, but our specialty is you.
Your family is our family. The staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.
Russell Regional Hospital, experts, neighbors, friends.
Dr. Tyrel Summers received his medical degree from the University of Kansas School of Medicine in Kansas City. He completed his residency at the University of North Dakota Center for Family Medicine in Bismarck, North Dakota. Dr. Summers is board certified through the American Board of Family Medicine and is a member of the Kansas Academy of Family Physicians, American Academy of Family Physicians, and the American Medical Association. His professional interests include chronic care management, gastroenterology, pain management, and psychiatric disorders. Dr. Summers has been affiliated with Russell Regional Hospital since 2015. Our phone lines are open at 800-337-4788 toll-free if you have any questions regarding chronic care. Doctors on Call brings you information which may be useful to you when you see your own physician. Thanks so much for coming back, and let's finish this series off, if you will.
Sounds great.
First of all, let's talk about what is the definition of chronic.
So chronic is something that we term in the medical field as something that's lasted longer than like 6 to 8 weeks. And so if an individual has an illness or something that's going to affect them for longer than that period of time, we typically label it as chronic. Now, if you're talking with a family medical provider, they normally list something chronic as being something someone's going to deal with lifelong. And so for example, like hypertension or diabetes, chronic obstructive pulmonary disorder, heart failure, those would all be conditions that we would label as chronic.
What about something as far as Alzheimer's or dementia?
Yeah, so dementia is definitely one that when someone develops it can be a chronic issue as well. It takes special management to make sure that the individual's being watched closely, and that's really what the importance of kind of having a primary care provider that does chronic care management is good for. They're able to watch kind of progressions in disease, they're able to adjust treatments based upon how the individual's doing, and that's the real whole purpose of chronic care management.
And can you talk a little bit more in depth about the treatment that might be involved with those patients?
Yeah, so specifically for dementia patients, the first thing that we do is we look at what type of dementia is there. Alzheimer's is one type of dementia, but honestly there are several different types of dementia that we need to differentiate and kind of evaluate to find out the best treatment course. And so one of the first things that we do is determine that. We can do that with testing. Sometimes we do cognitive examinations, sometimes we do imaging, sometimes we do a bunch of different things to try to figure it out. And then once we've determined what type of dementia is present, we then direct treatment based upon it. For Alzheimer's dementia, sometimes that's medication. The primary ones we use are donepezil or Aricept, and then Namenda is another good one that we'll use as well. But there's honestly several different types of dementia, and treatment varies based upon what type is available.
Now, what advice might you have for those patients, their caregivers?
Yeah, so the biggest thing in regards to dementia is realizing that the individual is going to need a lot more care than the standard individual, and that because of their memory problems, they're going to be challenging to take care of. One of the things that we really try to focus on with chronic care management isn't just taking care of the patient, it's making sure that we're taking care of family and caregiver, because there's a lot of fatigue that's related to taking care of these individuals. Some of their state is very much like taking care of a child, in which case they're bigger and stronger than your average child, and they can be a lot to deal with. And so when we see individuals, we really like them to follow with their caretaker so we can assess how they're doing and how they're handling the situation. It's not uncommon that if they're having a hard time will even admit the individual with the dementia or the underlying problem to give respite care to a caretaker, which is basically us providing, it's kind of like babysitting in a way to that individual, but providing care for them so that that individual can get some rest.
Okay, good information. We want to remind our viewers that we are live right now, 800-337-4788. You might not see that number on your screen, but we are accepting calls if you have a question about chronic care tonight. What is COPD and how can a patient obtain relief from that?
So COPD is a chronic obstructive pulmonary disorder, and it's a disease that happens within the lung tissue proper. It's caused by two different main reasons that occur. So the first thing is bronchitis, which is an inflammation that occurs within the bronchial tubes. That's the tubes that connect the main trachea tube to the lungs themselves. And that bronchitis can cause swelling and inflammation, making it hard for air to pass between the two areas. The second thing is the process called emphysema. And emphysema is an enlarging of the alveoli. And those are the little tiny air pockets that allow exchange of oxygen and carbon dioxide within the lungs. And they become bigger. When they become bigger, it makes it harder to exchange the same amount of oxygen and carbon dioxide that you had previously. And those two processes together, you can imagine, can take an individual from being able to breathe healthy to being able to breathe very much poorly. And so what we typically do with individuals with chronic obstructive pulmonary disorder is target treatment based upon helping them with both the bronchitis aspect and the emphysema aspect. That's sometimes given by like inhaled medications, but every now and then we have to use oral medications as well for treatment.
All right. What are some of the symptoms of chronic pain?
Yeah, so chronic pain is a really interesting process because it all differs based upon the individual that you're presenting with. It can be something as simple as like chronic lower back pain from issues with a previous fracture. I have several patients who've had falls and end up with fractures and then have chronic pain secondary to that even after repair occurs. You can have an individual get a kyphoplasty, which is a rebuild of the vertebrae that they've broken, and you would think you've fixed the break, it's fixed the person, but that's not always the case. Chronic pain can be extremely complex as well, though. There's some pain syndromes that cause a lot of difficulties and issues for a patient. And one of the things that's really challenging, but a lot of fun and interesting about pain is trying to determine exactly what you can do to kind of help with individuals' pain. Because sometimes you have to focus not just on the musculoskeletal aspect, but sometimes you have to focus on the neurological aspect of their pain. Sometimes it's arthritic pain, so you have to do something different. And trying to figure out how the best way to treat people is very rewarding for chronic pain management providers because they're able to try different targeted treatments to see if they can help the individual. And giving pain relief to somebody who's been in chronic pain is an amazing experience, to be able to see them functionally get better, to see them be able to go and like walk with their family or go out and shop when they used to not. It's an awesome experience.
Now, do you find a lot of chronic pain sufferers, it begins as an injury?
Most of the time, yeah. It begins as an injury or like a recovery or something that happened. But yes, the majority of times it's like a complication that occurred after an injury or after a surgery or after some type of mechanism caused problems. The majority of individuals that I see, it might be like wear and tear arthritis over time frame. That's another really common thing that we see. Some individuals, it's an autoimmune disease like rheumatoid arthritis or psoriatic arthritis. There's a plethora of different things, but definitely injury is a good common cause for it.
And what's the difference between acute pain and chronic pain?
That's a great question. Acute pain is something that happens very actively during an instance. Say, for example, you fall, break your leg. It hurts. That's acute pain. It hurts because you've caused an injury to the tissue. Your body responds to that by releasing a whole bunch of hormones, a whole bunch of chemicals that tell you that it's swollen, it's painful, and that it hurts. That pain can be treated with a number of different medications based upon what you need, and normally goes away with time. However, what happens with chronic pain is that the area where the pain signal kind of comes from becomes abnormally mixed. It starts to send signals to the brain and to the spinal cord that you wouldn't normally expect in healthy tissue. And that can cause this kind of spiraling out of control of just having a hard time controlling that pain. Now that's really only specifically with nerve-based pains though. I don't want to overgeneralize and say that's what everyone's pain is caused by because that's not always the case. Some people can have problems with like structural issues. So for example, their hip or their knee doesn't line up the way that it should line up. And so that causes chronic discomfort and chronic pain because it's wearing down on the joint quicker. There's a whole bunch of different reasons why you could have chronic pain, but that's kind of the separation between acute and chronic. Is normally acute pain gets better after a period of time, normally anywhere between about a couple days to 6 weeks. Chronic pain persists, and normally there's a trigger or a reason why that happens.
Okay, we want to remind our viewers that we are talking about not just chronic pain right now, but chronic care as well with Dr. Tyrel Summers. Give us a call. Our phone lines are open at 1-800-337-4788. Let's talk about how you assess pain.
Oh, yeah. So pain is a really difficult thing to assess as compared to other things because pain is really what the patient is feeling. And so as a physician, you have to be able to try your best to get that from history more than a physical exam finding. When you listen to someone with chronic obstructive pulmonary disorder, you can sometimes hear wheezing, you can sometimes hear a decrease in breath sounds, you can sometimes see them physically struggling talking to you. With a patient with pain, yeah, they might have a grimace on their face, their walk might be abnormal, but sometimes they'll come in and they look just like a regular person. You have to really talk and communicate with them by saying, how did your pain start? Where do you feel it? We often ask them to rate their pain, to say, 0 out of 10. What's your pain at currently? At worst, what is that? There's a lot of detail that goes into collecting a history for a pain patient to make sure that you understand where their pain process is coming from, and it might give you hints as to what's causing their underlying pain. It's not uncommon for me when I first see a patient for pain to review their chart and try to collect some of that information, but to sit down and talk with them for about the first 5 to 10 minutes, just trying to collect as much information as I can to make the best judgment I can towards what's causing their pain.
And we were talking about how a lot of chronic pain starts as an injury. If a person suffers from an injury, is there a way that they can help prevent that chronic pain from developing?
Yeah, so studies have shown the best way to prevent chronic pain from happening is to treat the acute pain as well as you can. That doesn't mean that you need to be super aggressive or that you need very strong, powerful pain medications, but you do need to be addressing your pain adequately. Because studies have shown those individuals who sit there and they're in pain and in pain and in pain over and over again without addressing it are more likely to switch on those changes that can happen with chronic pain. And so it's much more important to make sure if you're seen in an emergency department or you're seen in your local provider to make sure that they're talking to you about your pain and trying their best to address the pain. Again, that might not mean that you get very, very strong pain medications. It might mean that you need a different course of action or a different treatment. That's why communication is so important between provider and patient.
And are there other symptoms that are associated with pain?
Yeah, so chronic pain doesn't just present itself with just pain only. In fact, one of the number one symptoms that I see with people with chronic pain is depression or anxiety, because it causes a lot of wear and tear on the individual to have to feel the amount of discomfort they do daily. They also have a lot of functional problems. They're unable to use different limbs, unable to move, unable to ambulate like normal. And so there's a lot of social aspects that you have to take care of too with them. Some of them need specialized equipment. I've gotten powered wheelchairs for individuals that needed it. Some people need walkers. Some people need specialized braces. Some people need referral on to other providers. I do a lot of pain management via medications and via kind of medication reviews, but I do send individuals to interventional pain management where they'll do injections, they do implants, they do a bunch of different things. And even then, they might need surgery. And so getting them connected with the right specialist is really important.
Now we have to bring it up at least once.
Yeah.
COVID-19, has it made an impact on chronic pain sufferers?
Yeah, it sure has. Yeah, chronic pain sufferers with COVID-19 seem to get much more severe illness as compared to other individuals. And then there also seems to be a link between long COVID syndrome and people who have chronic pain, especially chronic kind of thoracic pain. I've had a few individuals that we've read about that there's case studies about having just chronic discomfort in the musculature of the chest wall because of COVID, long COVID especially.
Lower back pain is pretty common. At what point should you call your doctor?
So that's a good question too. Lower back pain is pretty common for a lot of individuals. I know when I go out and lift things, move things I'm not supposed to, it hurts my back, as it does the majority of people. Most of the time, if you try just simple things, heat, ice, ibuprofen, Tylenol, whatever works better for you, and give it a few days, most people will get better without much problems. However, there are some things that you should look for that are kind of red flags, I guess, that I would call them. The first thing is a special process we call the radiculopathy. Now, radiculopathy, you feel like a lightning bolt sensation, maybe pins and needles sensation that goes down like a leg, that goes down like the back of a thigh. It can be in the buttocks itself too. If you feel something like that, that's normally a sign that there's been an injury to a nerve. And so assessment would probably be smart in that case. Another thing too is if it causes a huge functional problem. So what I mean by that is if you can't walk, obviously we should be seeing you. We should be assessing you quicker rather than later. If you're having problems with limping or having problems where you're kind of dragging a leg behind you, that's another big thing. If all you can do is roll one direction or move one direction, we should really see you then too as well. So simply, you can always try kind of simple over-the-counter things to see if they help, but if you have any of those red flags or you have concerns, always come in and see a provider. We'll take a look at you.
What is chronic fatigue syndrome?
So chronic fatigue syndrome is a really interesting process because it's kind of one of those things where you have to rule out a lot of other things before you can get diagnosed with chronic fatigue syndrome. But it's this process where you have this underlying cause of fatigue that's normally an undiagnosed like autoimmune process or a problem within the body where your recovery time really isn't the same as normal individuals. And so with a lot of sufferers of chronic fatigue syndrome, how it works is they normally have like other underlying processes like fibromyalgia or like chronic pain. And because of that, it causes a lot of stress and a lot of kind of wear and tear on the body. And they have a hard time kind of recovering from just everyday normal activities. If you suffer from chronic fatigue syndrome, going grocery shopping can be a very hard chore. They can have a difficult time where moving, doing things becomes very, very challenging. And they're chronically tired. Like they're the kind of individuals that they just tell you all the time when they come into the physician office, I just don't feel right, I'm tired, nothing really is going right. And so whenever you hear those kind of words, it's always one of those things that we think in the back of our mind, is this a possibility? But normally we do have to do a pretty extensive workup to find out if there's really another cause for fatigue.
Now, can that contribute to chronic insomnia?
Yeah, so chronic insomnia is a really interesting thing. Chronic insomnia is really something where you're having difficulties falling asleep or staying asleep. Chronic pain and chronic fatigue do weigh in with insomnia itself, especially chronic insomnia syndromes. Yeah, they're all kind of connected together. That's what really makes this really challenging because a lot of the times what's causing one is causing both and all, to be honest with you.
Sure. We want to remind our viewers that we are taking calls right now at 800-337-4788 if you have a question about chronic care with Dr. Tyrel Summers from Russell Regional Hospital. That number again is 1-800-337-4788. You mentioned fibromyalgia. Let's talk about what that is and some treatments for that.
Yeah, fibromyalgia is an interesting disease in that the best way to describe it for me, or at least how I define it to a lot of people, is imagine your sensory nerves, which are responsible for detecting like touch or pain or temperature, are turned on for no reason. They can cause abnormal signals within multiple different areas of the body and can cause a lot of confusion for the individual. It can be very painful. It can be very, very frustrating because you'll feel pains come from really anywhere and they cause just really any kind of problems with an individual. Again, kind of like chronic fatigue syndrome, chronic insomnia, it's one of those things where we have to make sure there's nothing else truly that's going on with the individual before we tell them that it could be fibromyalgia. There are also some very strict guidelines in the diagnosis of fibromyalgia and very specific tests that need to be done for an individual with fibromyalgia as well. But if you've been having just random recurrent pain that really can't be described, that really can't be defined, it's one of those things that seeing an individual and going through that process would be wise, would be very good.
What is carpal tunnel syndrome and how is that treated?
So carpal tunnel syndrome is actually a compressive neuropathy that occurs within the carpal tunnel, which is actually in the wrist proper right here. It normally happens because of overuse of the hands, and it normally causes a neuropathy in the fingers. And what I mean by that is it's like a numbness and tingling initially, but can turn into a pain as time progresses. Normally the fingers affected are the third, fourth, and fifth finger, but in the severe forms, even the first and thumb can be involved. Truth be told is for most individuals with carpal tunnel syndrome, just simple bracing and over-the-counter medications can help. When it gets more severe, doctors can do injections into the carpal tunnel proper. Normally those injections are with like a cortisone injection. And so it's an anti-inflammatory to help settle down inflammation that's in there. If that doesn't work, the individual might have to have a carpal tunnel release, which is a small incision within the wrist that helps open up that carpal tunnel so that it no longer compresses on the nerve. So it's a very handy procedure, works very well. Carpal tunnel is an easy thing that we can take care of. So if you have any problems with carpal tunnel, please see your physician. It's pretty easy to take care of.
And you mentioned neuropathy. Let's talk a little more about that.
So neuropathy is a kind of catch-all term that I use a lot to describe kind of abnormal signals that occur from nerves. So there are dozens of different types of nerves within the body, but the main ones that we're talking about when we're talking about neuropathy are nociceptors or pain receptor nerves. They determine a whole bunch of different things. So for example, one of them is in fine touch. So if you poke yourself and you feel that sharp pinch, that's that specific type of receptor. When you hold something that's too cold or too hot and it stings, that's another pain receptor that's there. With neuropathy, what basically happens is something causes an abnormality in the signal to come up and down the chain of the nerve so that it's interpreted incorrectly. A good example of neuropathy that is very common is neuropathy caused by diabetes. And so in that case, what happens is the individual gets like pins and needle sensations. It normally starts in the bilateral feet, but sometimes it can go to the hands as well. It can go all the way up to the calf sometimes, and they normally describe it, like I mentioned, as kind of a pins and needles sensation that's there. And what's occurring specifically with them is the excess sugar that's within their bloodstream is actually depositing on nerve receptors and causing those receptors to send those abnormal signals. Most of the time neuropathy is very challenging because there's not really a known cause that's found with most individuals. And so it's one of those things where, again, we have to diagnose and look for normal causes for neuropathy, but sometimes we just don't find it. There are medications that specifically help slow down the feelings that come with neuropathy. There's also medications that help with the discomfort that comes with neuropathy. So it's a very easy to treat disease, but can be very hard to diagnose. And so if you have issues with it, again, it's another great thing to talk with a provider about for sure.
You were talking about nerves. What causes a pinched nerve?
Well, so a pinched nerve can happen for a number of different reasons, but again, most likely trauma is the reason why. So if you run into something, if you throw something or kick something that you're not supposed to and you start having pain, it can be a pinched nerve. Most of the time, what you'll normally experience is it will follow a very specific pathway. So for example, like let's say you get something up in your neck that causes problems. You might feel it kind of go down the arm, maybe even go into like a finger in a very specific process. It can cause weakness, but most of the time it will cause like a lightning type of pain sensation, or maybe even like those pins and needles sensation that I mentioned. In rare cases, it can even cause like a burning kind of sensation that's there. Most of the time, with time, they do get better. Unless they are really severe. If they're really severe, they may not get better, in which case interventional pain management might be needed. Sometimes we do cortisone injections, other treatments to kind of help with it.
And what are some tips that you have for someone who might be living in chronic pain? At what point do they need to get to the doctor?
So a chronic pain sufferer should really work with a provider sooner rather than later. If it's something that you've been dealing with for months now, it's probably time to at least sit down with them and talk about your pain proper. They may not be able to make your pain go away, and that's by far one of the hardest discussions that I have with patients who have chronic pain, because I often tell them, look, like my goal in trying to help you here isn't to make you pain-free. I wish I could. If there was a magic switch on your back, I'd flip that switch in a minute and get rid of your pain. It would be amazing, but there's not. Most of the time what I tell them is we're looking to make you functionally better as an individual. I often sit down with them and I ask them about a goal. I say, is there something specific that you'd like to get out of this? I might get the response, oh, I want to be able to garden, or I want to be able to, see my grandkids and go shopping with my grandkids. And I say, good, that's a great goal. Let's see what we can do to make that happen. Having that kind of a conversation with the provider is really important. They might be able to determine what they can do to kind of help you. And there's a balance of medications, there's a balance of interventions that can be done to maybe help with that. And the first thing to do is to talk with us to make sure that we're trying our best to help you.
And what are some of the risks that are involved for a chronic pain sufferer who is looking to get prescription pain meds to obtain relief?
It's really, really challenging because there's a massive stigma against individuals with using chronic pain medications, and that makes it very, very challenging to seek out care from a doctor. I get that. I understand that. I've even been guilty at times myself of over-judging people because of their need for pain medications. It makes it very tough. I understand that. One thing I tell people often is if you go with an open mind and just trying to go to figure out what you can do to help yourself, they may not be the very start given like pain medicines that you're wanting. You might get different types of medications, and that's okay. Most of the time when you try a different kind of medication, it might minimize your pain more than you think. I'll give you a great example. One of the medications that I use often for arthritis-based pain is an antibiotic medication. And most of the time when I explain that to a patient and I tell them, hey, I'm going to give you this antibiotic for their pain, they look at me like I don't know what I'm doing and kind of are confused. But the truth is for some individuals that suffer from chronic arthritis, that specific medication has been shown in studies to help minimize joint swelling and joint pain. And it's really worked for some of those individuals. Has it worked for everyone? No. It doesn't work for everyone. And that's one of the things that I really enjoy about chronic pain management is I get to work with the individual more so than anything else. Like when it comes to a patient with high blood pressure, you just give them the same medications. You watch their blood pressure goes down. It's a good thing. It's great. But the truth is when you get a chronic pain patient, you'll sit down with them and you'll think you're going down the right pathway. You'll give them this medication expecting it to get better, and it might, but it might not. In which case you have to go back to the drawing board. And I often find myself revisiting what I'm thinking and retrying different medications, or even saying, I know we tried this medication in the past, but I want to try it again with your new medications to see if it works better. It's kind of like experimenting in a way, to try to find something that works optimally for your patient. And that's a really rewarding experience when you can get it right.
Can lifestyle modifications help reduce a person's pain?
Absolutely. Yeah, that's 100% the reason why we want people to be more functional. Is because as you move, as you use joints, as you use areas that you couldn't use previously, that often stretches muscles, that helps kind of reactivate some of those muscle fibers that weren't working previously, that helps support the tissue that's now hurting. It's really important to keep yourself mobile. As I mentioned with my acute kind of pain issue, the sooner that you can get it under control, the better. And that's the same way with chronic pain. The sooner that we can get you feeling a little bit better, the sooner that we can get you feeling better overall by getting your pain a little bit better treated. And sometimes you need just a simple medication to help reduce the swelling, to help reduce some of the discomfort to make things better. So yeah, getting right ahead of that, getting yourself moving makes a big difference. The second thing that comes with lifestyle modification is diet. Now diet is a kind of tricky thing when it comes to chronic pain because there are some things that have been linked to kind of helping with chronic pain. I know the supplement turmeric is one that a lot of people say kind of helps with their chronic pain, and I always suggest individuals to maybe try turmeric to see if it will help. Another big thing that kind of people have been talking about is CBD and CBD oils themselves. Again, if you look at studies, there's no clear-cut study that says that it's beneficial, but some individuals do use it and do find help with it, which is great. If it helps you, again, it's an individualized thing when it comes to chronic pain.
Okay, great. We got a lot covered tonight. Thank you so much for being our guest, Dr. Tyrel Summers from the Russell Regional Hospital. On our next Doctors on Call, our topic will be cervical cancer. You can email questions to us for our next program. That email address is doctors@shptv.org. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Hutchinson Regional Healthcare System. Our family caring for yours.
At Osborne County Memorial Hospital, our services range from clinic visits to inpatient and skilled care, but our specialty is you.
Your family is our family. The staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.
Russell Regional Hospital, experts, neighbors, friends.